Hi, guys. We have company coming. I don't know who's visiting. High level, this means clean up downstairs. I love the University of Chicago. I'm a hard worker. I like people who work hard.
We always refer to Mary Pat as the solutions implementer of the department. And everyone goes to Mary Pat for any problems they might have, from finding a desk to booking a room or anything else you could think of.
There's no name on it, and I don't want to hear. I don't know.
Sunanda, who has a doctorate in physics and came to stage as the director of a movie program where she makes documentaries about people's science journeys. And I'm an open book, I don't have a secret. And so when I first got my diagnosis, Sunanda was one of those people that I talked to about the diagnosis.
I remember the time when she told me about her cancer diagnosis. She literally told us that they are going to cut open my jaw. But she was very practical about it right from the beginning. And she wanted to know more about the problem. What could be done? What were her options? Who could she talk to? And so she was again very solutions oriented, even when this difficult thing was happening to her in life. There are a lot of new treatments coming out every day. So I think we should consider all of them.
My name is Mary Pat, and I have head and neck cancer. About 7 years ago, I noticed that when I drank out of a bottle, I aspirated. I think a lot more than other people aspirated. I put my finger very, very far down my throat and I thought I felt a lump. I told my dentist about the lump and they didn't see the lump. And then year number 3, I went to my primary care physician and I said, I think that lump is getting bigger. And he said, I don't find a lump. Do you want to go see somebody else? And I was like, yeah, I think I should go see somebody else.
Usually these are symptoms that relate to the head and neck. So, for example, sometimes an ulcer in the tongue that doesn't go away. Other times, patients can present initially with a painless lump in the neck. Other times, if a cancer is developing in the voice box, there could be symptoms related to the voice, like hoarseness or voice changes or things like that. Carcinogens, such as tobacco or alcohol, are certainly have been for many, many decades and remain an important cause of head and neck cancer, particularly squamous cell carcinoma, the most common subtype. So HPV is a sexually transmitted disease. Most of its reputation is around cervical cancer, where it's much better known. And now, actually, oropharynx cancers are actually the predominant HPV-associated cancer that we see.
But I remember walking the dog one morning thinking, I've been married to my husband for 40 years. And I am praying that he had an affair and gave me some kind of sexually, because it's the easiest to cure. And that wasn't the case. This adenoid cystic carcinoma, you're genetically inclined to get it. They think that there might be an environmental chemical or something that you're exposed to that triggers a change in the way your body processes that. And then this adenoid cystic carcinoma is really slow growing, which is why people don't get good results.
The role I played in Mary Pat's treatment and cancer treatment was one, being a friend, and two, providing her with the resources she needed to get through this. So I started reading research papers and providing her with the top end research in the field. And I have to admit, we were all very afraid for it because this is a very aggressive cancer.
Either the tumor has grown to a certain size or has invaded some of the local structures and extended, sort of describing the areas in which the tumor itself involves, and or a tumor that has spread to lymph nodes in the neck.
The research that I started on my own was very, very scary. It had a very, very low survival rate over the course of 5 years, and the gold standard for treatment is excision. If excision was possible, and the MRI showed that the tumor was, I'm going to say, the size of the tip of my thumb, and if excision was possible, it would be a long recovery thing. So 70% of my tongue would go. I'm not sure that I would be able to learn to talk again. But otherwise I would, if I survived, I'd be on a gastric tube for at least many years.
You know, in Mary Pat's case, the conversation in her case and often in other cases is actually led by the surgeon counterintuitively, right? It's the surgeon that's saying, look, this is what a surgery to remove this tumor would look like. This is what the impact that this type of surgery would have on long-term function and quality of life, and then asking the question, is there an alternative way to treat this? But I think have the psychosocial aspects, because it's high value real estate, because of the impact on speech and swallowing and communication, because of the cosmetic impact of head and neck cancer, the psychosocial aspect becomes more important than for other cancer types that maybe one can't see visibly on the surface in the same way. It's definitely case by case, but oftentimes a chemotherapy and radiation or a non-surgical based approach is actually the right approach for many local regionally advanced head and neck cancers, while at the same time preserving long-term function and quality of life.
Line has been changed and it's connected to your heart right here. Where you've changed.
I was documenting moments of Mary Pat's treatment informally, and we wanted to create these moments which she could fondly remember. And of course, the changes she went through were pretty enormous.
I never really looked at the film of the radiation until about 4 weeks ago, and I found it fascinating. I didn't really think about her filming at all until afterwards, when I saw the pictures, and I saw the pictures of us in the hospital room with some friends gathered around. I think it was a birthday cake for me towards the end of my treatment.
Good job. You're good.
I don't know if I'll go back and I'll look at them again. I don't know. It's like vacation pictures. You take vacation pictures and then do you look at them again, or do you not look at them again until you clean out that drawer? I'm not sure how I feel about it.
One of the most important developments in head and neck cancer is non-surgical approaches with combining chemotherapy and radiation.
I can't ever thank Dr. Rosenberg and the other doctors on my team at the University of Chicago. I mean, I did my share, but they brought the tools to make me successful.
I was just so curious about the things that the nurses were saying about her, that she's one of the few patients who comes in walking to a treatment so late in the game, right towards the end of her chemotherapy when the body is completely worn down. And she would not want to sit on a wheelchair. She would not need help from the nurses. Those kind of moments were what I wanted to capture and show her what she has been through and how she has overcome this and succeeded in her journey.
I want to say I'm very healthy. I have to think about some things. I don't drink anything with bubbles in it. No soda pop, no seltzer water, because it hurts because of the scarring in my throat. But I have untold energy, unreached depths up. There's nothing that limits what I can do other than some difficulties with swallowing. And then next March, I do full testing, and if all that's clear, I'm all done with everybody except the ENT. I just retired. I think that a whole new part of my life is opening up. I'm really excited about what's coming next. I don't know what it is, but I'm very excited.